Good morning, everyone. I'm Gábor Balázs, the head of the MUTK, the Hungarian Organized Societies company. I will be the leader of today's webinar, and I think that there is 37 people in the attendees list, and 7 panelists is here. So I guess that it's time to begin. First of all, I try to share my screen. I do my best. I hope everyone sees my screen now. I'll be the chair of this webinar today, and it was first a few sentences about our projects behind this webinar for those who are not familiar with WELLBASED project, which is a European Union project which funded from Horizon 2020. It's a research project aiming to have design urban programs which reduce energy poverty, and with doing so, it's improve the effects of citizens' health and well-being. This project is not just a desk research type of project. We have 6 pilot cities in 6 different countries, from Spain to Latvia, where different energy poverty reduction program is introduced, interventions are introduced, and we are testing the results of this, mainly focusing on the health aspects of the improvements. And today's webinar is about an intermediate introduction what we find up to now. We are in the middle of the project. The project will end in the end of next year. And we are trying to show some results which could be interesting for all of you attended today's webinar. We will have 4 presentations. 2 of them is about the results of our testing and impact assessment we are doing on these pilot projects. The first is from Amy von Grieken, who is coming from the Erasmus University Medical Center. She will introduce the quantitative results, and then Peppa Ambrosi-Albala from University of Leeds will introduce the qualitative results of this research and impact assessment activity. And after a few Q&A sessions, we will have insight to one of the case study, one of the pilot cities from Valencia, introduced by Pilar Jorda Artigas. And finally, as our project is aiming to support local communities in their activities, in their work on improving health conditions through some fighting against energy poverty, then Miriam Eiser from Energy Cities will introduce a manifesto which is aiming to help local policies to foster local policies. This is what is going today. Before I'm giving the floor to Amy, I have a question. Is there any question from the participants before the agenda, which could be discussed now? If you have any question, then please put it on the chat or the Q&A box. I haven't seen any, so I think that it's time to give the floor to Amy von Grieken. She's an assistant professor in the Erasmus University Medical Center, and she will make a presentation of our first findings on our pilot projects. Amy, the floor is yours.
Thank you. I will also share my screen. Yes, so thank you for the introduction. So my name is Amy van Grieken. I work as assistant professor at the Department of Public Health at the Erasmus Medical Center in Rotterdam. And I will present some of the first findings from our baseline data analysis, which I didn't do alone. So I would like to give credit to my colleagues at Erasmus MC, but also the other partners of the WELLBASED project who helped in doing these analyses. So I will present some descriptive findings using the baseline data, which was collected up to September 2023. In this deliverable, we also present the findings of the qualitative interviews, but Peppa will discuss these later. And if you're interested in the full report, it's available at the WELLBASED website, and it also contains some of the pilot-specific results. Now I will only present the overall findings due to time. So the data we collected was collected using different methods. So in the intervention and control group, we used a questionnaire. It contained questions about socio-demographic information, but also about health, well-being, and energy use and energy poverty. In the intervention group, we did some additional assessments about health monitoring using certain health devices. We collected information about heart rate, blood pressure, oxygen saturation, and peak flow. And in addition, participants complete a questionnaire about their sleep quality. Also, intervention group participants had a sensor in their household which tracked temperature, CO2, and humidity. So in total, we have over 1,000 participants in our sample. Here you can see the distribution across pilot sites. And you can see that in some sites, the blue is the intervention and the green is the control group. In some sites, it's almost equal. And in other sites, there were, for example, in Jelgava, there was a little bit more difficulty in finding participants for the control group. And in Leeds, this was more challenging for the intervention group. But overall, we have almost equal distribution, about 600 in each study group, which is great. So I will start with sharing some findings from the baseline questionnaire, which was done in both study groups. So here you see the response percentage. Here also some slight differences between pilot sites, but overall we had a response of 88.5%, which is really quite good. So who participated in our study? The average age of our participants is almost 50 years. We have a little bit more female than male participants, but this is still a good distribution, and it allows us to later on also look at differences between females and males, as we know that women might be differently affected by energy poverty than men. And we also have about half of the sample either married or single. Then here we have some descriptives about the education level, the paid work, and the household composition. Most interesting to indicate here is probably that we have quite a large percentage of people not having paid work. So over 60% indicated not having a paid job. And with regard to household composition, a little over half of our sample lives without children and the other half lives with children. So this is also equal percentage almost. Looking at where the people live, we see that we have a comparable amount of people that owns their house and rents their house, but about 25% lives in a rented house that has reduced rent rate or social housing. And most of the houses are apartments or flats. Going through the results for health and well-being. Here we can see the findings for the health-related quality of life, which gives an overall picture of the experienced health-related quality of life. So it's a subjective measure. We have 5 scales, which you see the first 3, that the blue bar is the highest, which indicates no problems. But for pain, discomfort, and anxiety and depression, you see a different distribution. Especially the slight problems have increased, and also the severe problems. So this shows that most people report problems on these two scales, so the pain, discomfort, and the anxiety and depression scale. And this is in line with what we find on the mental health and well-being. So we see about a third to 40% of our sample indicating that they experience depressive symptoms or anxiety or stress symptoms. Looking at the physical health, it's quite a high percentage that indicates that they have 3 or more chronic conditions. And the same we see is that also a lot of people indicate they visit the physician more than 3 times in the past year. So both the mental well-being and the physical well-being indicate that these people are quite vulnerable and have some health issues. We also looked at the health of older participants specifically, so frailty, which is a measure of overall vulnerability on several areas in your life. I only picked out a few skills here because it's too much information to tell everything. But what you see here is that ADL is activities of daily living, and EADL is instrumental activities of daily living, such as cooking or preparing food. So actually something you have to do according to a certain order or structure. And we see that especially with the instrumental activities of daily living, 15% indicates that they are experiencing high level of risk for frailty. The overall score also shows that about 40% has a moderate risk for frailty. So frailty, it's common among older people, but we also see it in this sample. Yeah. The next part is about the energy consumption and the energy coping behaviors. So we asked people what kind of energy sources they use, and they could pick any. So it's not, they could pick any answer, but we see that most people indicate they use electricity. We also asked about the consumption and also the cost, but this question was really difficult for people to answer. So not everybody has easy access to this information. And we had a lot of missing data, but after leaving out some of the extreme values, we get to an average cost of 123 euros per month. But as you can see, there's quite a high standard deviation, so there's a big range around this number. We also asked whether people get support towards paying your energy bills, and a lot of people indicate they get some kind of support. The highest percentage is a fixed amount of money every month, I think we asked, or an in-kind contribution. And this is quite nice because we think not everybody can find these support measures, so it's good to see that some people can. Then we asked the energy poverty indicators, and yeah, so the blue bar indicates, yes, I am, for example, comfortably cool, and no indicates I'm not comfortably cool. So we see that a really high percentage indicates not being comfortably cool during the summertime, and 70% is really high. But we also see that about half of people indicate having areas on their utility bills. Also, almost half indicates that in their house there's presence of leak or damp or rot. And 60% is not satisfied with their home. So on all energy poverty indicators, we see that people are really suffering from energy poverty. We also asked people how they dealt with the problems they were experiencing with regard to energy. And here also the yellow bar indicates they take these actions often or always. So we asked them, for example, do you wear extra clothes to keep warm? Over 50% indicated that they did this. Also almost half indicated that they turned off heating or cooling to save money. They only heat or cool one room of the house to save money, or they turn off the lights in the rooms also to save money. So people are actively taking action or coping with their situation, and really also quite high percentages. Then moving on to the health monitoring. So these are the findings in the intervention group only from the health monitoring devices. So here you can see the number of participants in each pilot site is the green bar, and then the blue bar indicates how many of these participants have had one moment of health monitoring. So there is a health monitoring moment every month, and we use the first 3 months of health monitoring. So ideally people would have had 3 moments of health monitoring, and you can see in the numbers in the bars indicate that in each pilot sites participants had 3 or more health monitoring moments. So this is really great because it's really difficult to get these get the participants to collect these data because it's intensive. So this graph presents the first, the second, and the third health monitoring moment, and the percentage of people that, according to their blood pressure, have hypertension. The percentage of hypertension is in the green part of the bar, and it's about 20 to 30%. And on the right, if you're interested, there's also the average blood pressure. As I'm not a medic, this does not tell me that much. Then we move to the heart rate, and here you can see the same. So the first, the second, and the third health monitoring moment, and in the green is the percentage of people with a heart rate above 90 beats per minute, and this is about 10% each monitoring moment. And on the right, again, the average heart rate. Then the next measure from the health monitoring is the peak flow. So this is essentially the exhalation rate, or the amount of air that you can breathe out in one breath. And we have here, I think the legend is not fully correct. In yellow is the red zone. So these are the people that are having a very low amount of volume in one breath. So these are at risk, and it's about 20 to 25% per health monitoring moment. We also asked about the sleep quality, which is a subjective measure of how people rate their sleep. It has different scales. I indicated with the red line in the middle, the 50%. And here you can see, for example, with usual sleep efficiency, that about half report no difficulties, but also quite a lot of people, about 20%, report severe difficulties. And the same is for the sleep latency. We see about half indicating moderate difficulties to severe difficulties, but the other half reports no to little difficulties. So sleep latency is how easy you fall asleep. And for sleep disturbances, quite some people report little to severe difficulties. Sleep disturbances mean that you wake up, you cannot get a good night's sleep. Finally, we have some results from the home sensors. So these were taken only in the intervention group. On the right, you see the pilot sites, in green, the total number of participants, and in orange, the number of installed sensors. So if more than one participant in a household participates, there is only one sensor installed, because we have one sensor per house and not per participant. So these numbers in the orange can be lower than the green. This graph is showing the daily temperature over all households. So all the home sensors that were installed were taken, the data was taken together for each day, and then the average is shown over time for each pilot site. So for example, in blue is Edirne, and in yellow is Leeds. And looking at the overall picture, you can see that over time, so from winter to summer, so from left to right, you can see the temperature indoor increasing, which is in line with the outdoor temperature increasing. And you also see that in the more southern European countries, the temperatures are higher during the summer, and thus the indoor temperatures are also higher. A similar graph here for the daily CO2 levels. Not all pilot sites had these data available, but here, yeah, it's a little bit more difficult to interpret, but you can see the CO2 levels going down when it becomes summertime, probably because people open the door or the windows more often. So a lot of descriptive findings. So I try to give some summary to key findings. So what we see is that participants experience mental health problems such as feeling anxiety or depressive symptoms. We also know that a lot of people report chronic conditions, and also a lot of people visit the doctor 3 times or more in a year. In the intervention group, we have about a quarter reporting hypertension, and also quite a high number has a limited peak flow, also indicating some physical health issues. With regard to housing, we see that our participants live in houses with damp and leak presence, and they're uncomfortable in summer and also not satisfied with their house. And in order to deal with their living situation, they wear extra clothes, turn off heating or lighting. And at the same time, we also see that they are having utility bill paying problems. So despite some challenges we had in the participation of participants, we managed to get a very nice data set, thanks to also all the efforts that the pilots did. So we will continue this work. We will collect data in the future, so we will have repeated data available in order to study associations over time between energy poverty and health, and also study the impact of the intervention, comparing the control and the intervention group outcomes. As we already see that there are differences between the pilot sites, and we need to take this into account when further looking at the data. And it's also important to monitor the interventions people are getting in the intervention group, because this provides more context in what's happening in these pilot sites. And it's also great that we have the qualitative work, which Peppa will present later, because when we combine this with the quantitative data, we get a more comprehensive overview of what's happening in each pilot site. So I'm happy to take any questions later on during the Q&A. And again, the link for the full report if you're interested.
Thank you, Amy. And we will have a Q&A session after the second presentation from Peppa. She is presenting the qualitative findings. Peppa, the floor is yours.
Okay, thank you. I'm just gonna share my screen, just a moment. Just a moment. There we go. Can you all see the presentation?
Yeah, we have seen it.
Okay.
Sorry for the participants. You can write your questions in the Q&A box during the presentation, and we will discuss it after the presentation. The floor is yours.
Okay. So I guess this is all okay. You can all see the screen. So, hi, my name is Peppa Ambrosio. I'm a research fellow at the School of Earth and Environment at the University of Leeds. As Amy said, I'm going to present some results for the qualitative work, also within the frame of WELLBASED. So in this case, I'm going to present the results of the pilot case study of Leeds. So this is, again, not only my work. We've been working with, this has been done with Lucy Middlemace and also Jamike Olowe, who is our health technician. So I think it's important also to give credit to that. And of course, each pilot has also worked quite rough in their own cases. So presentation today also I'm quite mindful about the time. We will basically look a bit in what we intended to do with the qualitative work in the project, and what is that specifically we're doing in Leeds. I will then present some results. from the case study of Leeds and some experiences, how actually some quotations from people explaining how they live energy poverty and how they affect their lives. And then finally, I will present some key messages or take-home messages we should consider. The reason why I'm presenting the Leeds case is because well, this is obviously is more like this is the work I've been doing, but also because we are at 6 pilot cases, and as it happened in every research, they are all a different path. So I thought this is the analysis of these cases almost finished for the first round of interviews. So that's why I will be presenting this. However, we anticipate that results are going to be pretty similar in all 6 cases. So, well, what is that we're trying to do with this qualitative work in WELLBASED? So basically, what we want is to understand experiences or real life cases of how people pay for energy and how they use energy at home. And then we want to understand whether that has changed recently under the context of the cost of living crisis, and mostly after the intervention, before and after the energy interventions that all are going through. What do we understand about energy uses or practices? So that means like the different heating and cooling practices, how they use it for washing, for cooking, for lighting, to dry clothes, and which are the type of electrical appliances they have at home. As you can see, and you will see later, part of these results also support what Amy has found, some coping mechanism and how they light, they wash the clothes are already, are already in practice. So again, during these interviews, what we did in this qualitative work, in this interview, we asked about those experiences and how they managed to access energy to meet their needs. So this is important here because it's not only to have energy access, but if they are actually able to meet their needs. Well, that was said before, but we are going to test this energy intervention in different 6 pilot cases in Valencia, in Helen, in Leeds, in Ederne, in Obura, and Yelgaba. So the way we address this qualitative work is like it was through a one-to-one, we say interview, but more like discussion. So we let people talk about their experiences. We have a guideline prepared, and then we know more or less what we wanted. We knew what we wanted to know, but obviously we let the person that was talking through their experience to, in a way, guide the discussion. We understand that talking about energy poverty is quite a delicate issue. It can bring some stigma. So we really need to be mindful about those things. Well, all in all, the questionnaire has like a brief guideline, and the question talk, the main points were about the house, the home, and the household. So, for example, we asked how many people live in the house, how energy is used day by day or daily. Would they manage to have the house at a good temperature? For example, in the south of Europe, whether the heat waves, how they cope with the heat waves, was it how they experience thermal comfort. We also wanted to know how affordable the energy bills were, how they deal or they cope to make those electricity bill affordable, and what are the wider effects of this situation of living in energy poverty for their lives. Finally, we also want to understand more about how these energy interventions affect their lives. So this is also important to say. There's going to be 2 rounds of interviews. The results I'm presenting today is for the first round that was took place in the winter this year, before the intervention was finished. And then next year, hopefully, we will do the same. We will conduct another round of interviews, and it will be after the intervention. So we hopefully expected to see whether there is any change in those questions. So specifically now, we're going to talk about how the WELLBASED project is in Leeds. I want to present some data about how energy poverty is experienced in Leeds using numbers. So we've seen that there is an increase in the users of food banks. around 24% more between 2018 and 2019. This measure of low income, high cost of energy poverty is also quite high here in Leeds, in the north of England. Is around 10.3% of households in Leeds are already experiencing energy poverty. So what are the kind of, where are we focusing on in the case of Leeds? So the intervention is taking place in high-rise building or housing, is social housing, that was built in 1960 and is owned by the local council. So we've seen some of these towers of these blocks of flats have been insulated using external cladding. So this is basically the intervention that has taken place in Leeds. So we want to compare experiences of residents in similar blocks that has been insulated and some other that has not been insulated. So what we do, as I explained before, we work with the tenant and we try to identify and visit relevant households, and also we try and signposting them to additional energy saving advice. Okay. What is that or how is energy poverty affected well-being? So we want to understand basically is what kind of intervention works, for whom, in which context, and why. So the fieldwork in Leeds was conducted in March, and another interview were done in the summer 2023 this year. 11 interviews were conducted in terms of gender. Well, we have 5 males and 6 females. We found a mix of households, so there was places with just one person, single mom with children, a family with both mom and dad and the children. So we have a wide range of demographic, let's say, spectrum. They come from different origins as well. So we have British national and immigrants. Also, it's very important to understand that when we do qualitative work, we don't look at numbers so much. So you might think, oh, they only had 11 interviews. We try to understand and go into deep. So we are not so much into the general numbers and try to infer the data, but we want to understand in a way also to set the basis for future research. Okay, so what did we found? In terms of how they access energy and they use energy at home, we already see that people are struggling to keep, people in Leeds, struggling to keep their household warm and comfortable. Many of the houses, as I would say, most of them have problems with mold and damp. And this actually affects, this is all under the context of the cost of living crisis. And this affects the perception they have about their home and their house. As Amy presented before, we support the idea that energy poverty affects health, both mental and physical. The way they interact within the house and the condition of the house have constrained the social interactions. We see they are limited based on how many people they want to invite of the house. They feel a bit ashamed sometimes to see or to show what they have inside. We also see that because it's very difficult for people to pay for the electricity bills, they are already trading off and prioritizing needs. So there were stories of people that were saying they would obviously prefer to buy clothes for the children instead of buying clothes for themselves. They will be very mindful in how and when they will turn on the heating. So all those patterns are actually causing stress and anxiety. And similarly, this is also exacerbated by the fact that energy poverty or the condition of the house is affecting the physical health. Many of them identify this poorly condition in the house connected to asthma, skin rashes, and recurrent colds. And then in terms of the interventions, we have mixed feeling in general. So I would say that they all found that the whole work was quite disruptive to their lives. They didn't have any kind of information about what was happening, when is it going to start, when is it going to finish. So they have no sense of control. And they talk about other works that the council was doing before, and they have pretty much the same feeling that they were not happy by the way that was doing it. In general, they have very negative feelings, and they all had to change many of their habits because it was quite disrupting to have all the scaffolding around the house. People were complaining that some rats would come up would come through the windows, for example. It was quite noisy, quite dirty. However, when you talk about what would they expect or the effect of these interventions, mostly all will have high expectations and positive expectations about it. And mostly they all expected that this will affect positively to their health. So what I'm going to present now, these are some quotes from the interviews, and they refer to different aspects of the broad topic of the qualitative work. For example, the first one refers to access to energy and using energy at home. And it says that, because it's just leaving me here, so this person actually acknowledged that being a single person in a house makes things easier. And he was also complaining that the hot water tank was big enough for him, but not in the case he will have someone else living with him. He was also complaining that access to hot water was quite limited during the day. And he said, if I had people staying here, or if there was more than one person in the house, then yes, that will become quite a big problem. This was a single mom. She talks a lot about mental health. She lives with her toddler, who's got some problems as well. And then she tried to explain her situation. They say they tried, the doctor, to give me antidepressants, to help me with my anxiety, to try and calm me down, just to sit down and relax. But it's only me and him. So I feel I need to get it all. She was quite, in a way, stressed about the condition of the house. She was complaining there was a lot of damp and mold, that she's very stressed because already the child is poorly, so she was constantly cleaning. I'm going to now talk about another quote about house conditions and health. This is a mom with 3 children. She's saying, we were asking how she feels the house, whether she feels it's damp, it's cold, it's humid. And she say, yes, now I can even sleep in my room because it's wet. My clothes have mold, my shoes have mold, my blankets, it's just everything. I just sleep there and I sleep here because I've got my own health problems. I can risk going there and sleeping there the whole night. She was saying that some parts of the house were in a way inevitable, and they couldn't actually live and sleep there because of the mold and the wet of the house. And I think this is quite a good quote, the one I'm going to read it, which is this mom of children again asking for support, because sometimes when we look at data, or when we look at people talking about their experiences about energy poverty, as I say before, it's quite it's a vulnerable issue. So people are sometimes reluctant to ask for support. And even though they know or they don't know there are resources out there, there's always this big barrier that just prevent them to ask for help. Then she's talking about the council and how she was asking for help with some problems of humidity and damp in the house. As she said, yes, we always tell them, each time we call them, they will never ever turn up on time. So here you can already see that the council is already failing here on how they respond to people when they ask for support. You've got to lie sometimes. I do lie. I'm such a good liar with them. Like, oh my God, the flood. My house is going to be full of flood and things like that. And they will put it as an emergency. Otherwise, if you tell them really what's happening, honestly, if you tell them, they won't come. So I think this is quite a good quote to also reflect on how once people even ask for help, what is the role that the counterpart is taking? How do they actually reply, and how efficient they are when they need to reply, like to answer and give an answer for that help. So finally, some take-home messages is what we see is like the most repeated issues is like people are struggling with the way they pay energy bills and how actually the cost of living crisis is affecting them. Most of them report that they live, the house condition or the house condition of the place they live in is quite poor. We see that they constantly talk about mental health and physical health issues that are actually a consequence of the house condition. Many of them also feel quite helpless and they have no control on their situation and how can they actually move on because they just feel they are stuck somehow. And this is related in the way they ask for support, whether they ask for support and how they expect the other part to reply and to that support. In terms of those energy interventions, as we say, there was lots of complaints about how this was managed, how it was planned, and how it was implemented. So I think this is something quite important to revisit. But all in all, people have positive expectations about how those interventions can impact their lives. So some key messages here is like, we see that the cost of living crisis and actually a situation of energy poverty affects mostly and more severe to family households, also because the resources sometimes is limited. People are actually aware of what is good living condition, appropriate dwelling, and health. So they are actually able to identify that many of the problems they have is because the condition of the homes or these are not adequate and they are not able to pay, for example, for energy bill. And then we saw that people are actually energy literate. They know which electricity appliances to spend, other than more expensive. They know how to use the dryer, whether to use it. So they are actually literate. So we shouldn't just say people don't know how to make the best use of energy. So it's not only about information because they know about this. And then some final thoughts about this first round of analysis is we already see that families are forced to make difficult decisions that are connected to food, to clothes. And in a way, as I said before, sometimes families feel they are stuck and this causes a lot of stress and anxiety sometimes. I also think that we should revisit the current system of benefits or how we are helping them and look at reducing this idea of energy poverty and inequality that sometimes is also, as I say later on, is related to broadening the scope of health expenditure that could help address health outcome caused by energy poverty. And then we also see some groups with less economic power suffering from access and meeting their basic needs. And then I think the final question should be, who should we really target? And maybe we need to rethink about more, what do we understand about inequality? That's all from my side. Thanks very much.
Thank you, Peppa, for the presentation. Now it's time for questions from the audience. As it was mentioned by Miriam in the chat, and I hope everybody sees it, we shared the exact URL for the report where you can find more information about all of these qualitative and quantitative information. It doesn't mean that if there is any question, we are ready to answer. Or answer it. So, please, is there anyone who is brave enough to be the first? If there is no question at the moment, then let's go further. Now we are going to see. Thank you, Peppa. Thank you, Amy, and please stay with us. And maybe in the end there will be more, with more information, more questions will arise. Now we are moving on to the next presentation, which will be a case study from Valencia. And this case study is presented by Pilar Jorda Artigas, and it's about how Valencia pilot project is going on. Pilar, floor is yours.
Hi, everyone. I'm going to share my screen as well. All right. Can you see it?
Yes, but not in presentation. Now it's in presentation mode, yeah.
Okay, great. Okay. So yeah, as you mentioned, thank you for letting me this opportunity to explain the pilot implementation in Valencia that we've been carrying together with my colleague Jorge Valls. And I am going to explain a bit how we do these home interventions. First of all, I just wanted to make a note on the first challenge that we face, that is reaching those vulnerable households, because also, as Peppa mentioned, is quite difficult. It's quite difficult to reach them because it's, of course, it's very sensitive population and it's quite delicate situation as well. So we came out that building trust together with them is a key point so they can open their house to you. So we came with the idea that we need in-between actors to reach those population, meaning intermediaries, social workers, NGOs, any people that they trust. And we meet with them, we explain the project, and they will just think about who could benefit from this project and just call them and make an appointment with them. We made a lot of on-site visits, meaning face-to-face meetings with people, and we also did a quite huge work of mapping in advance a lot of potential entities that we could work with. And now, just moving to the intervention level, we did this house intervention at 3 levels that I'm going to go a bit inside of them. Meaning the first one is bill optimization, then the explanation and installation of an energy efficiency kit, and finally the house auditing. And I just wanted to share a picture of one of the residential blocks that we've been intervening and visiting people living there. So first one is bill optimization. Of course, this slide is quite focused on the Spanish market, but I'm sure that there are similarities with the rest of the market. The first thing that we will do is check the type of market and tariff that the people had hired. In Spain, it's quite important if you are on the free market or in the regulated market, because only on the regulated you can apply for social subsidies. And also another important thing is to check the price of the kilowatt hour that they have hired, because we have seen like one person having 12 cents for the kilowatt hour and another one 35 cents, which is more of the double, and that means a lot. Then next thing that we will check is if they are eligible for any subsidies. In Spain, we have the social bonus, which is a bill discount on, it can be up to 80%, but also 40 and 65%, depending on some social and economic features, such as if you are a single parent family, if you have any disabled people at your home, if you are unemployed, if you are receiving any other subsidies. So they check all those features, and the company will check if you are eligible for one of these discounts. Also, another important thing is to check if the person has an adequate high electrical power, because you can save up to, I think, more or less 50 euros on the bill, depending if you have an adequate electrical power. The more you have, the more you pay. So we review the house, and if the person has quite huge electrical power, we will recommend to lower a bit if it's not necessary. And finally, and also very important thing is to check if the person has any additional charges on their bill, such as insurance and other services. We have seen bills with 20 or 30 euros just on insurances and services, which is crazy, and they weren't even aware that they had them hired. So if you don't know if you have hired these services, you won't be able to use it. So at least to inform them that they have hired this, they are paying for it, and then it's up to them to decide if they keep it or not. But it comes to my mind a case that an old lady was paying €7 for a pro version of the mobile app, and she didn't even have the mobile app. So it was she was quite angry when we explained her that she was paying €7 for more than 2 years with for these services that she wasn't even aware of it, and she was not going to use it. Moving to the energy efficiency kit, our kit is composed with all those elements. First, we have LED light bulbs. So we will check all the house illumination, checking if they have broken light bulbs or they have halogen ones. So we will replace them with LED bulbs. Also, we have weather stripes to help isolate all windows and doors, especially when you have a window that even when it's closed, you can notice that there is some airflow coming in. So weather stripes are really convenient on those cases. We will have also a consumption meter, which is quite interesting. We will check together with the participant the home appliances, and we will check also appliances on standby or even on off mode to check if those appliances were consuming even in off mode, and we found a lot of them. So that relates to the next element, which is the power strip. So just with one gesture, that it's to push a button, you will avoid those standbys. And at the end of the month, just step by step, you can reduce your bill with these little actions. And finally, a time programmer, which is really convenient for appliances that we only need at certain times of the day, such as the hot water boiler. If a person normally has a shower more or less at the same time of the day, we will program it so it's off during the day or the part of the day that the person is off at home, or even for the Wi-Fi or the router if people do not use it during the night. So more or less checking with the person wherever they see it's more convenient. And finally, the house audit. We will review all the house, as I said, identifying the strong and weak points, such as the house orientation, because it has a really lot of impact on how the direct sunlight gains. The heating and cooling system, if they have any, the presence of shutters as well to avoid those direct sunlight, especially during summer and all the heat waves that we had. The isolation as well of windows, doors, and everything, and also the presence of mold and damp. Or we will also review the state and use of appliances. For instance, we will review the fridge, if it's closing well, if it's closing properly, or if it's well regulated at the temperature. Also the washing machine, because you can save a lot of money by washing at low temperatures instead of high temperatures. Also the way they use the air conditioning, if they had. Also the use of oven, the dishwasher, or the electric kitchen. And finally, we will share with them a leaflet with good practices and some advice. But I would like to mention as well that many of our participants had also their own good practices, and they will also provide us some advice. So it's a quite win-win relationship. We will learn a lot as well from our participants. So it's quite interesting to learn about those good practices that people were putting in place before we visited them. Just a few pictures I wanted to share of our house interventions. Here you can see we were reviewing the windows of a participant. His house was really cold. They were not closing well, and he had a strong problem with the damp. Here we were reviewing the fan, putting in place some weather stripes on an old window. I don't know if you can see it well, but here you can see the damp on this wall. So this was quite shocking. And also this fridge had a huge problem of, as I mentioned, it was not closing properly. And even you can see the ice coming. I don't know if you can see it properly, but the ice was coming from the inside of the fridge. Even it was difficult to close the fridge door because of the ice. So it was quite shocking as well. So about our lessons learned, the most important thing is to spend enough time with the participant to check all the house conditions, the equipment, and the facilities. I think we were reviewing the house about for more or less 2 hours. Listen carefully to them, support them, create a safe space, because this way they can share with you their stories, they can share with you how are they living, how are they struggling to pay the bills, and the main problems that they are facing at home. And finally, offer personalized advice and solutions, because we have this kit, which is quite okay. It's quite a complete kit, but of course, every house is different. So we will adapt each kit to each house needs. And also, as you know, we are carrying a lot of workshops and trainings with our citizen school for the right of energy. We are now training people every 15 days, and we think that this is an important task of empower people, so they know what are their rights, what are their rights, and how they can use better their appliances, how they can apply for any subsidies for the social bonus. And finally, so to promote the right of energy, because as we have said, as we have seen on the previous interventions, it is affecting people's life. Energy is affecting people's life, their health, and their well-being at home. So it should be a right to access to an adequate amount of energy. So help us to promote this right. And that's all on my side. Thank you very much.
Thank you, Pilar, for this presentation, and it was really interesting to see how it works, how this project works in Valencia. If you stop your sharing.
Yeah.
Okay. In the meantime, we have got a question in a Q&A session, and before the last presentation, we were kind of policy advice or kind of policy presentation. I think that after Pilar's presentation, maybe we can move on to question and answers first, and then I give the floor to Miriam. So the question is in the Q&A session. I say, okay, I've seen it. So a question to Amy from Weekend. We saw in the slides that the 3 waves of monitoring questionnaires show decrease in number in high blood pressure and tachycardia problems. Is this results in relation with the interventions of the pilots, or only the change of the weather from winter to summer? Is the difference is there a difference in treatment and control group? What do you think?
Yeah, so interesting question. So to start with the last question, we only have this information in the intervention group, so it's not possible to compare to the control group. So we can only look at the trend over time within the intervention group. We only have the first 3 measures now, so I don't think we can draw any conclusion yet whether it's related to the interventions the people received. So we will have to see how the trend goes over time when we have more measures. And also, I think it's a good point about the weather. I actually did not think about this yet, but it would be good to correct also for these kinds of information. So now it's only descriptive. It's not corrected for anything. It's just the raw data, but we definitely need to do more complex analysis to correct for influencing factors like time of year. Yeah.
You especially do not have the right answer yet, but we see that there is a huge connection between the health condition and the insulation and the warmth of the food. Okay, there is another question now. How did you disseminate the survey in order to get a representative number of responses from people vulnerable to energy poverty of different social demographic types, low-income households, people from ethnic minorities, children, elderly, and women? I guess it is also for Amy, or maybe
Yeah,
it's for Pilar.
yeah, exactly. So I think this is really the effort from the pilot sites who did their very best to get this representative group from all these with all these characteristics, so to say. And I know it took a lot of how do you say, it was a big challenge to do this. But in a different per pilot site, how they approach this. So Pilar already maybe shared a little bit some of the important aspects of talking to these people and how you include them. And I think each pilot used a different approach. But yeah, I don't know whether there are pilots present who can share their insights. I think it's mostly just knowing, getting to know the people you're trying to find and really reach out to them in a good way. Yeah, it's maybe Pilar, you want to add to that?
Yeah, I mean, from what I know on each pilot, it has been different. So I just share what worked for us and how we reach people. But of course, if any other pilots want to share how their experience, it's always super constructive for us. So.
Thank you, Pilar. Thank you, Amy. I haven't seen more question in the Q&A, but
Can I just briefly?
yeah, Peppa, yes, of
So
course.
the way we did it, it was that's why I say there was quite a kind of like we have it was teamwork in our case. So our colleague Jamike, who is our health technician, was in the case of the qualitative interviews, she actually built a trust relationship with the people, and that was for us crucial. So her work and the relationship she built with them was very important. So because obviously it's like what we say, we're going to ask them questions that are quite personal, and so she managed to build the trust and then say, look, and from then that's when we say, okay, yeah, would you be happy to have a one-to-one conversation? So now it's always find a key person that would just build that connection of trust. It's just that's how it works for the leads case. Yeah.
You? Yeah, there is no other. As I see, there's no other questions, so I think that we can move on. Miriam presentation, which will be about our suggestion for local level. Miriam, floor is yours.
Yes, hello, good morning, everybody. My name is Miriam Eiserman. I'm from Energy Cities, European City Network, working on energy in the city in all sectors, and we're a partner in the WELLBASED project. You've already heard. Do you see my screen in full screen mode? I guess
yes,
so, right?
Yes.
Great. So yeah, we've already heard what some of our pilots are doing, and obviously we would want many more to work on this link between health and energy poverty. So now we're going to go from the micro level to the macro level, because what is needed is to have the right kind of political frameworks and strategies to make this happen. There is on the one side the EU and the national level, where we definitely need enough support also towards the local level, so that cities have enough means to carry out great programs. But then there's also the local authorities themselves who need to decide on making energy poverty and related health issues one of their priorities. So this is something that we want to kind of foster through our WELLBASED project as well. And that's why we've drafted a manifesto for local governments so that they can kind of work on better policies for healthy homes and fighting energy poverty, because we think that much needs to happen at the local level. That's where the energy poor and vulnerable people are. local government action can be kind of more immediate as well, and we need very person-centered and place-based approaches. That's also what we heard from Pippa and from Pilar. So it definitely needs to be a policy that is very much related to the local context. And so we want this manifesto to be signed by as many local governments as possible, so that they commit to a number of actions that can help improve the situation for people in energy poverty and suffering from related health issues. And so I just wanted to quickly present kind of what we have put in this manifesto. So on the one side, we describe kind of the energy poverty drama that we that people are going through and that we see in many of the countries. So the issue of undermined dignity, disproportionate suffering, and obviously the public health challenge that comes with it. I won't go into details because I mean, we've heard a lot already before my presentation, and I guess many of you who are in the room are alert and aware of the problems. The second thing is obviously the health drama. That's what we're focusing on. So the respiratory diseases, mental health struggles, chronic illnesses that come with it. So it's quite a long list, and it can potentially be even longer. So what we want local leaders to do is to take action, and that's why also with the help of our well-based pilots, we've listed kind of some of the key actions that we think are relevant if we want to advance on this issue at local level. It's nothing novel because I think much of it has already been said for a while, but we see that things are not moving on, and very often there is a focus on energy poverty as such, but the health topic is not necessarily taken into account. So what we want to do is really raise awareness amongst civil servants and especially the elected people that both need to go together. So what we think is that on one side, cities should connect energy poverty and health targets and actions in early stages of planning. So for example, when a city drafts its or reviews its sustainable energy and climate action plan, well, there should definitely be targets on fighting energy poverty and on improving health. And if this is in the strategic documents, well, it means that there can be action and also resources kind of channeled towards those activities early on. Then secondly, we think there needs to be a continuous training of professionals, so of energy experts on health issues, of health professionals on energy problems, but also training of public servants actually on both issues. Then thirdly, cross-sector coalitions would be very important at local level, so that health and energy professionals do work together, and that can be actually, and that's related to point one, that can be already in planning stages. And the other day I met someone from the city of Milan, and they're actually reviewing their action plan until I think beginning of 2025, and it's a collaborative work between three departments and three departments which are kind of covering both the social issue, the energy issue, and the economic side of questions. So I think it's a great example, and it could be an example for other local authorities as well. Then obviously, and that's even kind of an overarching commitment that needs to be put in place by local authorities, and also even more efforts by national governments around the renovations of the worst performing buildings. We will see how the new EPBD will be put in place by the national governments, but maybe local leaders can try to focus on that even before new legislations are there. And then And that's the last point in the list, setting up one-stop shops. In Valencia, for example, we see that this is really one of the crucial points where information gets together, where people have a first touch point, let's say, with those people who can support them. And that's where we can also start building trust. So having one or even several one-stop shops in Valencia, they even have 3 different ones in 3 different neighborhoods, is something where like the connections can be made. So this is what we've put in this manifesto, and this is what we really would want other local authorities to take up. We don't say that all needs to be done at once, but it would be great if local leaders could commit to this list. And yeah, so if you know a city that could join and that would want to join and sign this manifesto, showing its commitment and showing that it's concerned about about this very, very social and public health issue, then please flag it to us, and we're happy to reach out to the city, so that it becomes kind of a joint movement of cities working on that topic, because that's what we need. Thanks a lot for listening, and I'm available for any questions you might have.
Thank you, Miriam. And now we're going back to questions, answers, and remarks. So if somebody would like to make a remark on our project and our presentation, it's time for that. So yes, there is a question in the Q&A session. It's from Sergio Tirado Herrero. Hi all, thank you for your presentations. A question here about the Valencia and Leeds pilot cities, following up on something Peppa said about households experiencing feelings of resignation when previous interventions did not fulfill their expectations. I wonder if you are encountering persons, households, unwilling to participate in the project because they feel it will not bring any substantial change in their living conditions, and in which way, if any, mental and physical health issues influence their hope and expectation in this regard. So I think it's for Peppa and for Pilar, who is the first to answer the question.
Yeah. We had some people interested in the project, and when we explained how is it going to work, what are we going to do, and we encountered many people who thought that it will not change their life at all, and finally they didn't join. So we will try to explain that we can make a difference at least on the house intervention and the bills, even if it's not on the health part directly. But they weren't finally joining the project. It was not many people, but I would say at least 10 or 12 people out of 130 households. And regarding the health issue, I think most of the people are keen to have these health screenings monthly, especially old people, so they can be aware of how are they doing. And also one thing that really shocked me is that we had a couple of families that they will have never had their tension measured, which was quite shocking for me. It was the first time that someone will put a tension meter on their arm, and they were even like nervous and stuff. And yeah, it was quite shocking because they will have never had this thing measured. So I think they were like really happy to have someone coming each month, having those screenings.
Thank you. Peppa, would you like to answer as well?
I think in our case, what I saw is that people are more like, this resignation is more connected to the idea of asking for support, not so much in also the intervention, but like, why would they ask for support if they know that it hasn't, or for help if it hasn't worked in the past? So it's more connected to like, I'm not going to ask for help because it's not going to receive well on the other end. And then in terms of the interventions, I think in general, people, as I say, they have positive feelings about what the impact it could be. But it's more this idea of like things are the way they are. And sometimes, as I say, they feel stuck. They cannot move forward because it's this, they feel like whatever they do, they are not going to have the right answer. So I hope that clarifies a bit that whole idea.
Thank you. And now we get a question to Miriam, which is about the one-stop shops. That, I was wondering, does the health aspect also play a role in how you imagine these one-stop shops? So if people try to inform themselves about energy poverty and steps they could take to lower the debt load, would these also be discussed on how their health comes in? For example, when trying to prioritize health in the process of energy renovation. So, Miriam, do we have answer for this question?
Yeah, thank you very much, Thomas, for the question. Yeah, obviously, we would want those one-stop shops to extend from the topic of energy, because that's what is usually the core topic that is being dealt with in one-stop shops, to more health-related issues. So I think if we have people in those one-stop shops who are also aware of the related health problems, they might be able to ask one or two questions to the people who are coming into their shop, and trying to see, to identify if they are people who would need help. Well, either in terms of energy renovations, obviously. So there could be some questions around how their comfort at home is. But also maybe redirecting them towards the right health professional, so that yeah, the link can be made and they get immediate support. So yeah, it's definitely one of our objectives to connect both.
Thank you. And I think we have one more question also for you, Miriam,
Yeah.
which is about is any governments will sign the manifesto or already signed it? What do you think? I know we are focusing on
yeah,
local level.
we just started. So I guess you mean local governments, because that's whom we're addressing. We just finalized the manifesto, and we will only start now, kind of reaching out to local authorities or campaigning so that local authorities are ready to sign. So for now we don't, and it's just starting, and we hope to get quite a number of them on board. So that's why I'm also saying, if you know of any who might already be kind of in the starting blocks around those topics, maybe being already a bit kind of sensitized for the topic, please tell us, so that we can kind of go towards them quite quickly.
Okay, I have seen no more questions. Is there anyone else who would like to ask something or comment it? Then, if not, I think that it's time for a kind of wrap-up conclusion. Yeah, we get one more question. It's just a positive strengthening of our activities. So thank you very much to all interesting presentations. Thank you for the positive comments. And now, if there is no more, I wait 5 seconds. 1, 2, 3, 4, 5. Okay, nobody. And we are in the closing session. So as all the presentation were appeared, so I don't want to say too much about it. So the WELLBASED project is focusing on how the energy poverty and health issues are related to each other, and by solving one of the problems, how we improve the other one. What we have seen already from the results, you can see that there are a clear connection between health condition and energy poverty. It means physical and mental health issues as well. And we have seen in our questionnaire that there are many personal strategies, measures were introduced by households to cope with these energy poverty issues. And it seems up to now, according to the qualitative results, that the family households are in much more problem than the others. So we have to focus on them. And it is clear that we need to revisit our current system of benefits and focusing more on energy poverty and especially on the policy health issues. So maybe what to do is, which is suggested in the manifesto, to make connection between energy and health targets in an early stage of strategy making, to foster continuous training on professionals of all of the sides, and make a cross-section coalition of energy policy, social policy, and health policy experts. Speed up the renovation, doing the worst first approach, and finally, which was mentioned by Miriam, that we need to have a kind of one-stop shops where people with one of the problem recognize that they have answer for the other problems as well, not just energy but also for the health. So these were our second webinar in WELLBASED project. We will have a third one in the middle of spring. We will promote it a little bit later, but you can find our report with its preliminary findings as it is showed in the chat box, and it is in the slide now. And if you would like to have more information on WELLBASED project, all of the information is available in WELLBASED. There is a misspelling. This wellbased.eu where you can find more information on us. So thank you for all attending in this webinar, and have a good lunch. Thank you. And thank you for the presenters as well.
Thank you.
Thank you.
Thank you. Bye.
Bye-bye.
Bye.
Bye.
Thanks to all. Thank you.
Bye.